The Equitas Project is our national initiative to disentangle mental health and criminal justice. Thank you so much for joining our virtual conference series on mental health, excessive sentencing, and the death penalty. This conference, hosted by the Equitas Project and the Eighth Amendment Project, offers 60-minute panels each day for 5 days, with 2 of them today, exploring the intersection of mental health, excessive sentencing, and the death penalty. We'll cover all kinds of topics, which are all listed on the website. I won't enumerate those here, and we'll be screening and discussing the documentary Too Ill to Execute later in the week. And I just wanted to say, you know, among the nations of the world that Americans generally hold to be our peer nations, the US is unique in its persistent use of excessive sentencing and the death penalty. We hope that as you join us for each of the panels that we've assembled, you'll consider the 360-degree impact of our nation's attachment to torturous or nearly torturous punishment, inequitably administered, on the mental health of everyone involved, not just the individuals facing excessive sentencing, but also the jurors, corrections officers, prosecutors, defense attorneys, judges, mental health providers, advocates for social change, political actors, taxpayers, and all our children who so fervently want to believe and trust that ours is a just and humane nation. None of us who have our eyes open to the status quo of our system can experience the well-being to which we should aspire. Before we get started, I want to thank Sarah McGee from TASME and Stephanie Fauché from the Eighth Amendment Project, who've been indispensable to bringing these panels together, as well as Emma Troten and Adam Goss from the Equitas Project. I also want to acknowledge the very generous support for the Equitas Project from the David and Laura Mirage Foundation. All our advocacy work is possible thanks to the generosity of our partners and allies. Thank you for your donations. With that said, it's my pleasure to introduce our next session, Lessons Learned, Legislative Efforts to Protect Individuals with Mental Illness from Excessive Sentencing. Our moderator today will be Feranda Brassfield from the Eighth Amendment Project, and Feranda will introduce our other panelists. Thank you all for joining us.
Thank you so much, Vincent, and good afternoon, everyone. My name is Feranda Brassfield. I'm the Director of Leadership Development at the Eighth Amendment Project. And in my prior role as the Executive Director of the Arkansas Coalition to Abolish the Death Penalty, I worked on 2 successive SMI bills in Arkansas. We were not successful, but there are lots of lessons learned with both of those bills, and working in the Arkansas legislature to try to get those passed. I'm really excited to hear from our panelists this afternoon, our esteemed panelists, and I'd love to introduce them for you. First, we have Courtney Atnip. She is with Capital and Fifth Public Strategies, and they have been working on SMI. We have Ingrid Delgado from the United States Catholic Conference of Catholic Bishops. We have Tylisha Lumpkin from the Kentucky Coalition to Abolish the Death Penalty. They recently passed an SMI bill there in Kentucky. Congratulations on that. And we also have Lauren Snyder, who is with Mental Health Colorado, and she's here to share with us as well. I just wanted to start with a question, and my first question is for Courtney. Courtney, in Tennessee, you recently passed a bill to reform the intellectual disability statute used in capital cases and to bring it in line with modern definitions. And you've been advancing a bill to exempt persons with severe mental illness from execution as well. What sort of messaging have you found effective with legislators when talking about the need to treat individuals with intellectual disabilities or severe mental illnesses differently?
Well, thank you for the question. And hey, everybody, I'm excited to be here and grateful to be a part of this conversation with so many. I think this might be the largest Zoom I've ever been on. I look down, there's 192 participants. So it makes me a little nervous, but I think I can do this. So just by way of background for everybody on the call, for over 10 years was at the Tennessee Disability Coalition. So I was a disability advocate before I became a contract lobbyist and started my own business. So I kind of understood a little bit how the legislature understands and perceives people with intellectual disabilities or folks with mental illness. And I think that, we're in probably like my Kentucky colleague, but I think we're probably more red than y'all. We're in a super majority Republican state. Our legislature is 90% Republican. We have a Republican governor. Our constitutional officers are Republican. And I think there's perceptions about the conservative party that they aren't as, I guess, forgiving is not the right word, but accepting of those in the disability community. And I found that to actually be the opposite. They really feel compassion and feel like those individuals within the disability community do deserve state benefits or a little bit more leniency on issues. So kind of understanding their paradigm of how they understood intellectual disabilities. And let's not make any mistake, and I'm sure my colleague from Kentucky can say this as well, is that people with intellectual disabilities and people with severe persistent mental illness show up the same way. I mean, their needs are very similar. And so even though sometimes people at our General Assembly get confused on what is an intellectual disability versus what is a severe and persistent mental illness, their needs and the way they present themselves are very similar. And so, but that being said, so that the General Assembly has some compassion for that community. And what I found that really resonated with legislators is that they all know somebody that has an intellectual disability, or they all know someone that has severe and persistent mental illness. I mean, or they've been touched, especially in the mental health world, they've been touched themselves with a family member having that. And so really talking about what those folks, not necessarily their limitations, but the supports that they needed and the kind of individuals they are as human beings, really helped take away the gravity of what we were doing away from, modernizing the statute when it dealt with this intellectual disabilities, and really made it really about the person with an intellectual disability rather than about the crime or the person that had been convicted, more about what is the disability that themselves and don't they deserve a more humane treatment. And that really resonated with members. And there was a long history of intellectual disability advocacy that had taken place at the legislature, and our super Republican majority was really differential to that community. And so knowing that kind of compassion they had to that community and really playing on who these individuals are, these are people in your community that can make a mistake or they don't have the capacity to understand what's going on, really resonated with our folks. And the same goes, I mean, although have not been successful yet on the mental health piece, but I'm determined to get there. I mean, most of these members have been touched by a family member that has, mental health issues. And so getting them to understand, like if someone has paranoid schizophrenia, for example, do they deserve to be punishable by death? And I would say the majority of members, when you boil it down in that way and that kind of messaging, don't believe they do, because they understand that on a core principle, they don't understand the difference between right and wrong. So that's what worked for here in Tennessee.
Wonderful. Thank you so much, Courtney. And Ingrid, in Florida, what sorts of questions or pushback did you guys face from legislators when you were trying to pass a bill to exempt persons with severe mental illness from execution?
Thanks, Rondon. Such a pleasure to be with all of you today. So just to clarify, I currently work at the U.S. Conference of Catholic Bishops, where I work on behalf of the Catholic bishops of the U.S. on federal policy. But up until last summer, I worked for the state conference in Florida, working on state legislation. And we did, have the opportunity to work on SMI legislation, just like other Catholic conferences have as well in Kentucky, Ohio, South Dakota, Indiana, Tennessee. And I'm actually really pleased to share with you that we didn't receive a lot of public pushback on the bill. Of course, like with any policy issue that you're trying to move forward, it's a challenge to, work on something when there's so many competing interests. But once it started to, gain some traction, there wasn't a lot of pushback. So far, Florida has only given one hearing to this bill, but in that committee hearing, there was not a single member who spoke against the bill. There was not a single member of the public that spoke against the bill, and it actually passed unanimously, including votes from members who are on the record as supporting the death penalty. Now, in private one-on-one meetings with members, right, there are sometimes some questions that come up. And something that we've heard is, is this needed, right? If the court already considers mitigating factors, or isn't this already the law? And that's where we had to go into like what Courtney was saying, right? Talking about the differences between severe mental illness and intellectual disabilities, or the difference between mitigating factors and exemptions. And I'll also say that in private meetings, there were members that were concerned that defendants would fake mental illness. And so even though the bill language requires reports from mental health experts, this is why it's important to have those mental health experts as the leaders on this bill, right? Because they can correct the record about what, goes into diagnosing mental illness and correcting the misconception around faking it.
Awesome. So Ingrid, did you notice any set of common myths or falsehoods that needed to be dispelled in order to bring people over to your side?
Yeah, so advocates have come across the perception that the death penalty is popular. And so even though we were very intentional about always framing this as a mental health bill and not a death penalty bill, right? If members open that door, we could definitely counter that narrative, pointing to public opinion polling, right? And the consistent national trend away from public support for the death penalty. And then something that comes up, I think, every time we talk about something related to the death penalty, cost, right? There was a perception about this costing the state money. And in the one hearing that this bill got, the staff analysis actually said that this might create a fiscal impact. And so that needed to be addressed by, pointing to the fact that in general, right, not seeking death actually saves the state money. And lastly, I think advocates had to dispel the myth that only the worst of the worst are sentenced to death. Right? And so when this does come up, we have an opportunity to share the story of what mental illness really looks like, especially when it intersects with the justice system, right? People with mental illness might be less likely to understand their rights and their charges and may be more vulnerable to wrongful convictions. And so something that was done in Florida was, one of our allies submitted an op-ed to the Tampa Bay Times and told the story of Pedro Medina. And so if you Google Pedro Medina, there's a lot of attention that needs to be out there, right? About the fact that his execution was botched, about the fact that he has a really good case of innocence. But something that has been ignored is the fact that this man had a severe mental illness, right? He was hospitalized in Cuba until 19 years old for severe mental illness until the day he left Cuba. To the United States. And, he had a long history of mental illness, and it just didn't get the attention that it deserved.
Thank you. Thank you so much, Ingrid. Let's switch regions to Kentucky. Tylisha, in Kentucky, you just successfully became the second state to pass a bill exempting persons with severe mental illness from execution. Congratulations. Your bill was strongly bipartisan and had support from many people who support the death penalty. How did you make this a bipartisan issue?
Thank you, Ferranda, and thank you everybody for being on the call. I think Courtney and Ingrid, I feel like you guys were working in Kentucky with everything that you said. Those are the strategies that we used. Making this a bipartisan issue in Kentucky was something that we had to do. We have a Democratic governor, but we do have a majority Republican Senate and House. So this has to be a bipartisan bill. We had our Democratic brothers and sisters on our side. They're looking for full abolition, but we really had to make this a bill about SMI first and death penalty second. So really playing up on the fact that Republicans here in Kentucky are very, as Courtney said, They're very interested in SMI. They're very interested in individuals with mental health illnesses, people that cross those spectrums. So making sure that they were aware that this is something that your party is favorable to. This is legislation that you all have pushed in other sectors. Now we need to push it when it comes to criminal justice, criminalizing individuals that need help, that need medical attention, and then making sure that we aren't executing individuals with severe mental illnesses, individuals that may not have that capacity to defend themselves during trial, to answer correctly to questions when they are on the scene of a crime that could cross that capital punishment statute, making sure that our Republican sorry guys, my computer fell off. Making sure that our Republican legislators knew that we needed them as much as they needed us. So we started out this bill in the interim before the session, and making sure that we touched those Republicans that we knew were going to have a big hand in legislation here in Kentucky. We went to our Senate president first and said, this is a bill that we've introduced unsuccessfully. This is a bill that has came out of the House chamber before, that has came out of the Senate chamber before, but not simultaneously coming out of the two at the same time. How do we cross that threshold? What can we do to help your party get a win on mental illness? And what can we do for the Democrats to help them get a win on abolition? And our Senate Republican president is an attorney, so this was something that was an easy go for him. A lot of our Republicans in the judiciary and in the Senate are attorneys. So they were really ready to champion this bill because they've seen the cases, they've seen what's happened firsthand in court, or they've heard what's happened firsthand in court with defendants that cannot defend themselves on easier cases. And then to be faced with something such as a capital case that can really go left quickly. So we made sure that we had Republicans chairing this bill. We made sure that our coalitions were real coalitions, not coalitions in names. We were showing up for them, and we expected them to show up for us as well. So we really made sure that if someone isn't speaking to us because we're the abolition people, they are speaking to one of our coalition partners that will get us in that door, that'll have that conversation with us.
Thank you. And Tylisha, you guys had to make some changes to your bill along the way. Even limiting the scope in order to get it passed. How did you deal with the advocates that thought you went way too far with your compromises?
So I would say that one of the shocking things and one of the myths that we should dispel, like Courtney and Ingrid said, is that some of our advocates were Republicans. They were conservatives. They were the people that everyone says they're not going to go for it. They were saying, you're not going far enough. You're not going far enough. What do you plan on doing? But we also knew that we had some real hard-nosed individuals that were not going to let this come out of chambers if we did not have that compromise. So this compromise was a step, and we made sure to let our advocates know that this is a step. We compromised in a step. We were still walking. This bill is still going to go further than it is this session, but we had to take the first step. So those compromises, although we had to take those to get movement on the bill, those are compromises that we're working on right now. Before the session ended, those are people that we addressed and that we reached out to and said, we know that this bill didn't go far enough. Where are you willing to go next session? Where are you willing to go in the interim? What can we do? Who should we bring to get this bill further so we can get amendments on this bill, so we can get new movement on this bill when it comes next year? So even though we weren't able to make a large step, we knew that we had to make concessions to make a step, and that concessions came from both sides.
Thank you. And Courtney, how did you connect with allies in the disability rights and mental health space, and who were some of your most vocal supporters?
Well, like I said, I had been a disability advocate for a number of years before I became a contract lobbyist. And so our current client outside of the Tennesseans Against the Death Penalty is also the Tennessee Disability Coalition. And so using, and since they're a client and obviously representing the other side too, using our relationship with the Disability Coalition, and honestly, the history I had lobbying the legislature on behalf of intellectual disability issues created that natural narrative to have that conversation. And like, we targeted, our sponsors were two gentlemen that were compassionate for the intellectual disability community. Our House sponsor had always, since his tenure at the legislature, had always been one of the forefront legislators on specifically intellectual disability issues and advocacy. And then the Senate sponsor had a family member with an intellectual disability. And so what you really need, I think, in these, on these kind of issues, much to what the other panelists are saying, is you need someone that understands that diagnosis and can really, and it's interesting, I'm getting sidetracked real quick, but although to me, intellectual disability and a mental illness presents the same way, the legislature still sees them sometimes as the same thing or very differently. And so to your point about, and I'm going to point this way, who said this, to your point about dispelling the myths of mental illness and having a doctor come up and say, this is what it is. We didn't have to do that on the intellectual disability thing, because I think everyone understood an IQ less than 70 or around an IQ of 70. But I think there's still these large hurdles in the mental health space about what that, is someone quote unquote crazy enough? And I don't mean to be pejorative, but that's how these legislators think. Like, what does, is PTSD as bad as paranoid schizophrenia? And in the moment where they become like they're diagnosing individuals with severe persistent mental illness, you're going to lose the debate, right? So you have to pick the mental illnesses that are the most extreme to some degree so that they can have a visual of who you're talking about, because that's what they were able to do on the intellectual disability side. But, we've tried to run for a number of years that on the mental health place. And in the moment we start having doctors up there talking about the diagnoses, the legislators then wanted to, debate what the diagnosis is. And so I think it's better to try to stay away from that because I think it helps. I don't think it helps the cause to sit there and have a conversation about like who is, more mentally ill than the other. So back to your original question, I think that having the disability community as the person that was pushing the legislation versus the abolitionists, I think gave some credibility to what we were trying to do.
Thank you. Thank you so much, Courtney. And Lauren, as someone who's working in a mental health organization, what reasons would you give other mental health organizations for why they should be involved in justice reform issues, especially on issues that result in excessive punishments for people with severe mental illness?
Sure. Thanks for having me. Again, Lauren Snyder with Mental Health Colorado. We are a statewide advocacy organization for folks with mental health and substance use conditions. You can't be a mental health advocacy organization if you don't get involved in juvenile justice and criminal justice reform. Our people that we advocate for are in the juvenile and criminal justice systems at an alarming rate. And it's not just issues that you would think about with, with death penalty or otherwise, but other types of policies. For instance, Colorado is going through a fentanyl crisis, which I know many other states are, but our state is moving forward with legislation to felonize, to create a felony offense for individuals who possess fentanyl. Basically, going back to the failed war on drugs of the 80s, we are replicating that. It is a war on people with a disease. It is a war on the people we represent, a war on people with health conditions. And in order for you to be an advocacy organization, you have to get involved in those things. You have to have relationships with your DAs, with your public defenders, with your criminal justice reform coalitions. Also policies that you don't maybe not even think would affect your population, but do. In Colorado, we have excessive sentencing laws or enhanced sentencing laws for people who assault first responders. So law enforcement, EMS, or a nurse in an emergency room in order to protect those people. Those policies may work for people who understand that hitting a police officer is a bad thing, but when we create health systems where our first responders for people in a mental health crisis are law enforcement, not health responders, those laws disproportionately impact our people. you have in Colorado, there's an enhanced sentencing law for if you hit a person in a jail or spit on them. In Colorado, 1 in 4 of all of the charges against somebody spitting on a jail staff member are people who are incompetent to proceed, people who have already been deemed not sane enough to understand the charges against them. And our laws continue to call them a felon, even though we know that they are really, really sick. So I think in order to be a mental health or a substance use advocacy organization, you're not doing your job if you're not getting involved in criminal justice reform coalitions and reform. So.
Thanks, Lauren. Thank you. Can you tell us about the legislation in Colorado? The legislation that you guys have got to reform the not guilty by reason of insanity laws. And also, if you can kind of just let us in on why you are attempting that and why it's necessary in Colorado.
Sure. Colorado, I would say, has some of the most conservative not guilty by reason of insanity laws in the nation. Many other states, if you are found, I'm going to use the term NGRI, not guilty by reason of insanity. If you're found NGRI, the judge has a discretion on if you go to the state mental health institute or if you go into the community. Many people who are legally insane at the time that the crime occurred get medication, they get stabilized, and they're fine. In Colorado law, if you are found not guilty by reason of insanity, you have to go to the state hospital for a minimum of 6 months. So it almost feels like a sentence. So one part of the law is to allow that to be discretionary. So if you're found NGRI, you can go right into the community, or if deemed necessary, you can go into the state hospital. Also, what we are finding is our NGRI statutes and how our state hospital works, it's kind of like Hotel California. You can come, but you can never leave. People are literally having to sue their way out of our state hospital. And so we are requiring there to be annual reviews of if somebody meets an inpatient criteria, and if not, requiring the judge or the court to make a determination if they need to go into the community or if they can go into the community. So those are two of the things that we are working on to try and get folks who are found NGRI who have the ultimate stigma, right? There's one thing to have a mental health condition. It's another thing to have a mental health condition in the criminal justice system. And it's a whole nother thing to be labeled not guilty by reason of insanity. And so we're trying to advocate for a population that a lot of people look away from or don't seem to care about. So.
Well, thank you so much, Lauren. Thank you for that. And I've got a final question, but I'd love to ask, just kind of pass the mic around to everyone for this final question. And that question is, what is one lesson that you can share with advocates that are trying to pass legislation? And let's start with Ingrid.
Sure, thank you. And so I feel like Tylisha has done the work in Florida too, right? Like so many things that were shared were, lessons for us as well, right? Start early, start, in the interim, start in, before the session. Your key leaders, right, are important to learn about, to really target and know how to, strategize, know how to approach them with this issue. But I cannot stress enough the importance of not taking for granted or just assuming members' positions, right? The Florida Conference of Catholic Bishops always does a candidate questionnaire on the death penalty, and we have a Catholic Advocacy Day. We talk about the death penalty, but not everyone who supports the death penalty opposes an SMI bill, right? We found, surprisingly, that a lot of people who support the death penalty could come to that middle ground, right? And say, at the very least, we shouldn't be executing people with severe mental illness.
So what say you, Courtney?
I think the takeaway I would give for everyone, and I mean, probably because I'm an advocate at heart, is trying to find that personal connection with your legislator or your elected official on how they feel about those disabilities or those diagnoses in the mental health world, and trying to find those personal connections, because especially, like I said before, I don't mean to be repetitive, but you know, most of your elected officials will have a connection to mental illness, either a family or themselves, and they understand what that looks like and how that impacts their judgment and decision making. And I think that trying to boil it down to something that everybody can relate to is really the key to success too.
Awesome. Lauren, what is one lesson that you can share with other advocates?
I agree with everything that's been said, especially about getting to know legislators. There's not, you'd be hard pressed to find a single human being that mental health or substance use hasn't impacted in some way, shape, or form. And that is a powerful tool that you should be utilizing in any advocacy effort. But I'd also say build coalitions with other organizations. That needs to be a center point. You know, from social determinants of health advocacy organizations, housing, employment, counties, you know, other types of organizations. I think building a coalition is always going to make that lift so much easier.
And Tylisha, what is one lesson that you'd like to share with other advocates that are trying to pass legislation?
I think what we found successful, and one lesson that I would say is do not limit yourself. Don't silo yourself because of what used to be or what you may think is the case. I met with a lot of legislators that people said, don't bother meeting with them. Don't connect with that group. They are opposed to what you're doing. And those are individuals that said, no one has came to speak to me, or I've changed my mind. I've learned, I've heard things. I want to know. I met with a lot of legislators that were in a questionable state. They were following party, but they had questions, and no one had ever came with an honest conversation to them. So I didn't approach them as the abolition group. I approached them as an individual first. I wanted to know what they knew and what their understanding was, and then to tell them what mine was. We did not limit ourselves on who could join the coalition, who we reached out to. We met with everyone but 2 people in our legislature, and those 2 people were people that were out, one for health reasons and one just had a baby. So we met with everyone, even people that we knew were hard-nosed people that were always going to be anti-abolition. One of our legislators, Damon Thayer, during the confirmation of this bill, after the vote had went through, he stood up and he said, you know, this is outrageous. I can't believe our pro-life groups are supporting this. But we reached out to pro-life groups and we said, if you're pro-life, you can't be pro-life except. So are you truly pro-life? You know, so we reached out to those groups. So when he stood up and he said, I can't believe that people are standing here that should be against this, but I have to admit that maybe the tides are changing. So, and he had to admit that because we kept people in his face. We kept people there. So now he is not a person that is going to think that we're on the outskirts of things. We have people coming from every angle. We have different groups. We worked with our Catholic Conference of Kentucky. We had our immigrant groups coming. We had our Muslim and asylum seeker groups coming. We had high school children coming. We had middle school children coming. We had everyone that we could think of. Black Lives Matters coming. We had our Blue Lives Matters groups showing up. We made sure that we spoke to everyone and let them know that this is an issue. Regardless of which side you're on, it is still an issue that cannot be ignored.
Thank you. Thank you all for those wonderful lessons. It's extremely difficult work and it's cumbersome, and we appreciate you all sharing all of your experiences with us today. I'd like to take some questions from the audience. Audience members, if you have not taken the opportunity to do so now, you can type your questions into the Q&A. And we have a few questions that have already been submitted. And one of those questions, and I'm not sure who on this panel can answer this, but I'm going to pitch it. What work is being done in Georgia to eliminate the beyond a reasonable doubt standard to prove intellectual disability? Is there someone that has information about Georgia? And I'm sorry that we don't have that information, but we will try to connect you with someone that can connect you with that work in Georgia, Marshall. And we also had a question about categorical exemptions and eliminating the death penalty for individuals that are under the age of 21. If any of you have considered that as far as possible legislation in your state, and if you'd like to talk about it.
I think I responded to this question in the Q&A, but here in Kentucky, we are actually going through a challenge to a case on this currently. One of our judges out of Fayette County ruled in 2017 or 2018 that it was unconstitutional to impose the death penalty on a group of individuals that were charged with a crime that was death penalty related that were under the age of 21. That case is still ongoing. It went all the way up to our Kentucky Supreme Court this year. Our Kentucky Supreme Court denied to rule on it. They said that they did not meet the standing, and the reason for meeting the standing was that the case has not went to trial currently because of the challenges from the Fayette County judge that said that this is not constitutional. So that case is still going. Those individuals are of age now. At the time of the crime, they were not. Anyone that wants to look that up, if you want to look in Fayette County, the case is going to be Krueger, Krueger. And those individuals, 3 individuals that were charged with a capital case here in Kentucky. We have a lot of individuals that are pushing that case. We're looking to see where that case lands statutorily, where it lands with our Kentucky Supreme Court before we look into getting litigation or legislation for that case, because it may be ruled inside of our courts.
Thank you. Did anyone else want to chime in?
If I could weigh in quickly. In Florida, there isn't as much bipartisan collaboration around juvenile justice issues as there is around mental health, right? So even though I think it's such good legislation, right, to propose a bill like this, I think it would be really difficult in Florida, right? And seriously, in 2021, Florida just passed a bill creating a minimum age for arrest at 6 years old. There's no minimum age at which a child can be indicted as an adult in the state of Florida. So quite literally, my 7-year-old in Florida could be handcuffed and could be charged as an adult, right? The governor vetoed a bill expunging records after a juvenile has completed a civil citation program, right? So even though we know that prefrontal cortex is not completely developed, right, until early to mid-20s, and it would be great legislation, we just, at least in Florida and at least in one of the chambers, we don't have the same bipartisan support as we do around mental health.
That's unfortunate. Lauren, how do you work with DAs and prosecutors?
Sure. I mean, just like any other stakeholder, it's creating relationships, meeting each of our DAs and our association. We have an association of DAs, elected DAs in Colorado. Working on things like DA-led diversion. What can we do? What type of resources do you need in the community? I think a lot of what we talk about with them also is they don't want crime to happen. We don't want our folks to get in there. Like, what resources do we need in the community to make sure that our folks never even enter this system, and asking for their help, literally asking them for help to support us, asking for co-responder models. If we were running a bill around co-response or whatnot, can we bring in the DAs to testify about why this type of resource is needed? Having those types of relationships so that they start to trust us, that we are trying to do the right thing, buys us more credibility when we maybe disagree about certain policy issues. We've worked very closely with our DAs on a series of incompetent to proceed bills and legislation about how we can leverage the civil system. So, and in lieu of the criminal justice system, how do we get people into the community? What resources do people need? Do judges need? Do DAs need to see in the community in order to get people out in jail or out on bond? Like, having that two-way conversation and relationship building is critical. I think also people don't tend to realize that prosecutors, DAs also experience a lot of secondary trauma. And having a relationship to talk to them about that, again, it's just relationship building. It says that we care about you too, right? Yes, we're on the other side of the fence most of the time on how our folks are treated in the criminal justice system, but we care about you also because you also have a mental health condition. And I think people don't realize that it's them. I think there's a quote later on about quote unquote crazy people. It's not, it's just a spectrum of mental health. And I think having those types of conversations are really powerful, especially when you're talking about victims also, right? DAs are really victim advocates also. They experience trauma. Being a mental health organization that is able to have the bandwidth to advocate on all of those levels buys us credibility when we go toe to toe with them on policies that involve the criminal justice and criminal justice reform. So I hope that helps, but yeah.
Thank you, Lauren. And we've got it's a comment and a call for thoughts from Isabel Sanchez Cummings. It says that Courtney's response was really powerful because she spoke to the idea of language. People use crazy and other words like that, coupled with the idea of overusing PTSD, stress, depression, etc., can make understanding mental health issues challenging. However, it can also make mental health issues more relatable, meeting people where they are. Do you guys have any thoughts about that comment?
Well, I was typing a response, and that she's absolutely right that you have to meet someone where they're at and how they understand the diagnosis. The challenge that we have here in Tennessee is that lawmakers weigh those diagnoses differently. So you're not at, and I hope I'm not offending anybody by using the crazy term because I don't mean that, but it's like PTSD isn't as crazy as bipolar with hallucinations. They, in their mind, they think they know what PTSD looks like, or they think they know what manic depressive looks like. And so they weigh those differently. And so when you begin to kind of parse out those diagnoses, and what we found in committee specifically, when we were able to move, we were able to move the SPMI bill several times in committees. And one time we had doctors testify, and that didn't seem to be as effective as we did. We had legal experts, because the moments we had psychiatrists and mental health experts talking about the diagnoses, lawmakers were instantly like, that's not severe enough. They can't be exempted from the death penalty. And so we had to do this really delicate dance of not, and then the next year when we moved it with the legal folks, that actually had a little bit more momentum because we didn't get into the weeds of what the diagnoses are. So to her point, yes, you have to meet people where they're at. The challenge that we had is that they think they know what quote unquote crazy enough looks like to be exempted from the death penalty. And we all know that not to be the case, obviously, because they're legislators. So who might have their own mental health diagnoses, let's be honest.
Rhonda, I wanted to just add on to what Courtney's saying, because I think what people need to understand also, and what I didn't touch on yet, is the reason why we landed on such a limited scope of what is considered a disability in our SMI bill, is that we had legislators that felt that some things did not hit that limitation for them. A lot of conversations came around the capacity to understand, well, this individual, and we're talking about legislators that aren't doctors. So bringing a doctor there, we definitely saw the same thing. So we went the opposite route, even though we did work with NAMI and we worked with our SUDs and our OUD groups, and we worked with our national associations for individuals with disabilities. We also saw legislators after our disability day say, well, I met with some really great individuals with disabilities, and I don't know if the capacity, and that was like the complete opposite of where we wanted to go. So we saw that backpedaling once they met with individuals that have a disability but can hold a conversation. So it wasn't the individual with the disability's capacity to understand. It was kind of our legislators' ability to understand.
Amen,
what,
Seth.
what a disability is and what it entails when you have a group of individuals coming for a national disability rally and you're saying, I don't think that's a real disability. So we landed on those limited disabilities because they were those most extreme cases that a lot of our conservative legislators felt that's something that I can get behind. That's a disability that I recognize. So when we had schizophrenia, we had schizoaffective disorder, those bipolars, those are things that they said, yeah, this is a person that's never going to understand. It wasn't to disqualify that disability on our end, that other disabilities were not, but it was something that the legislator felt they could do behind.
Right, because they were able to understand what that looked like. Right, exactly. I totally agree.
I think I would just add that. Oh, sorry, go ahead, Ingrid.
Sure.
So I think the only thing that I would add is just that, especially when we're talking about the intersection of mental health and the criminal justice system, there are mental health conditions can affect anyone at any time. And I think for us, it was bringing in people who do have a serious mental illness, someone who does have schizoaffective disorder or bipolar disorder or whatever, and showing that they're just a normal human being. They are like your cousin, your mom, your neighbor, that literally they are no different than you. They just have a different health condition that you can't see. And I think for us, educating people on that, and that it is a condition that people can live in recovery from, that they can live normal lives with, is a really powerful thing. And I think it's important for us as advocates to also use the correct terminology set by example of these are the words that we use when describing an individual with health conditions. We don't call them schizophrenics or whatever, that we treat them with dignity and respect in using our terms. And I think that's the most you can do is just use the right words, educate people, because I do think people want to be educated. Not everybody knows this lingo or terminology. And so we always do a handout of person first language. What are the terms you use? Because I think people actually want to know what is the term I use. And so giving them that education to just say, hey, you may not know this, but this is how we refer to individuals with a mental health condition or somebody with a substance use disorder. Please don't call them addicts. Please don't call them XYZ. So I think being proactive in how you use language and putting people in front of other people makes it a reality that we're all humans, and that this person has more likelihood to enter the criminal justice system as a result of their health condition, and why these policies are so important. So.
Absolutely. Thank you. Thank you all for your very thoughtful answers. We've got just a few more questions. And one of them is there any movement on helping offenders living with autism spectrum disorder?
You know, the answer to your question is there has been, here in Tennessee, there has been legislation for that community, specifically around if they have committed a crime and how the law enforcement has to engage with those folks, which I think has been really helpful. There hasn't been necessarily a push on exempting them from the death penalty, but I think that, you know, I have a former mentor, a woman I used to work for, that used to say, and I think this speaks to what the other panelists are saying, that her quote was, it doesn't matter what you call it or how you got it. The point is that you're here. And so, and for me as a former disability advocate, and probably will be for the rest of my life, honestly, it all presents the same to me. It's like you need help, you need some services for you to live your best life, whether you have intellectual disabilities or mental illness, or you have an autism spectrum disorder. And if you stumble into the criminal justice space, much like my colleague from Colorado said, I mean, your diagnoses or your illness it gets even worse. And so how do we keep you out of that? And so we haven't necessarily tackled that yet in Tennessee, but there have been other proactive pieces of legislation to kind of help that interface with the criminal justice system.
Thank you.
That's where coalitions come in. Mental Health Colorado, when we run a piece of legislation that, for instance, we ran a piece of legislation last year trying to end the use of solitary confinement for people with disabilities in our jails. We advocate for people with mental health conditions, but of course, we're going to introduce that bill that protects juveniles, that protects people with intellectual and developmental disabilities, that protects people with traumatic brain injuries, that protects pregnant people. And that's how we build coalitions, right? We got that bill passed because we brought in all of these other disability coalitions, and it was better policy. And so we did pass that bill. It does cover people with autism. And I think that's why you have to have good partnerships with other disability coalitions, because when they introduce a bill, you want them to include your population. And when you introduce a bill, you want to make sure that you're covering all of these affected folks with specific health conditions yeah. So.
Thank you. Thank you both. And Tylisha, there's a question. Did you have persons who actually were suffering from mental illness? Did you have those folks to testify in the legislature?
So I think that we did so much work in the interim and during session that when it came to the judiciary committees, we actually did not have to testify or have people present during the rulings. So only our legislator that introduced the bill had to come up, he had to introduce the bill, and then they moved to motion. So we had done a lot of work beforehand to where we didn't have to have a long conversation once it hit committee and was time to vote. We absolutely had individuals with lived experiences, individuals that are living with the disorders, meet with legislators, speak with legislators, some that were comfortable speaking with them on their own, and some that wanted us or another group to meet with them. We definitely had that. We had a full day in our legislature dedicated to where we just took over the Capitol. We had individuals in the lunchrooms, we had individuals scheduled for meetings, and it went well. They were not limited in what they could discuss with their legislators. We do not do that. We always say, speak with your legislator openly and honestly, have a real conversation with your legislator. We don't like scripts. We don't like anything pre-written because we don't want that repeated conversation. But we do ask them to bring up the legislation, to make sure they address that and share what they're comfortable sharing. We don't ask individuals to sell their stories, but share what you're comfortable sharing and have that personal conversation with your legislator, because this may not be the only time you have to address them.
Thank you. And we've got about 5 minutes left in our session. I've got another question, and then we've got a comment of sorts. One of our questions is, what about people living with traumatic brain injury? This is an overrepresented diagnosis on death row, as well as incarcerated and homeless populations. Have any of you considered that, or have you had that in your bill and maybe negotiated it out? Please chime in as you feel appropriate.
Yes, absolutely. There's been bills passed in Colorado that require screenings of traumatic brain injury, especially for juveniles. I think there was one last year, related to screening for in TBI in jails. And again, we passed our solitary confinement bill in jails that specifically said included individuals with TBI, but you're 100% on. It's a population we need to focus on.
So our original Kentucky bill that was submitted last session included all disabilities and mental illnesses and traumas. Unfortunately, we had to limit our scope. So removing TBI and removing concerns about those in the houseless community was something that we had to strategically do, but we do work with our homeless coalition to address houseless issues and to make sure that that population is being looked after. So again, like Lauren said, working with your coalitions, making sure that what you can't address, your coalition is still carrying is very necessary.
Wonderful. And we've got a comment from Mercedes that we're currently trying to get that kind of bill passed. That's awesome that it's passed in your state, and we're going to see what happens. It's called AB 26. Am I frozen?
You were for just a smidge, but now you're unfrozen.
Could you hear my comment from Mercedes? Mercedes has a comment in our chat, and we appreciate the very thoughtful comments and questions that have been placed in our question and answer. But she indicated that it was awesome that the bill had passed in your state, and they have a similar bill in California. It's AB 2632, and it's called the California Mandela Act on Solitary Confinement. We have
just, if I can quickly say, Mercedes, good luck. You can do it. Our bill was House Bill 21-1211. You can reach out to me if you want to collaborate on kind of information data we used and how it's going. So.
Thank you. Thanks, Lauren. And we've got about 2 minutes. And Alan is going to be our last question of the day. And has anyone done any work on the idea that persons who suffer from a combination of specific categorical mitigating factors, i.e. youth, intellectual disability, serious mental illness, and that those folks should be excluded from the death penalty?
Well, I think that's in Tennessee. I'm going to get out of my skis because I'm no attorney. Sarah McGee, my trusty attorney, might have to chime in. But I mean, the intellectual disability, you are excluded from the death penalty. The reason why we had to modernize the definition is that they were using an old definition of how they diagnosed intellectual disability, which was the hard line of a 70 IQ or below. And that is, one of the things I meant to point this out to everybody else as well. One of the things that really kind of connected with legislators on that is that in the special ed space, they don't even use that definition anymore. It's more of a holistic look at the person and all their capabilities and deficits around whether or not they have an intellectual disability. So we were able to kind of tie that back to the fact that when they diagnose kids in the school system, they use a more modernized approach. So in our state right now, you cannot execute someone with an intellectual disability.
That's
same for Kentucky. We do not execute individuals with intellectual disabilities, but we have had individuals on our death row whose cases have been overturned because we had to prove those ID cases. I think the last person's name was Larry White, and that was here in 2016.
Wonderful. Well, thank you so much. We want to give a virtual round of applause to our amazing panel today for all of the experiences and knowledge that you brought to this panel with you, very thoughtful comments. I appreciate all of the attendees. I too have not been on a virtual that had this many attendees in quite some time. So thank you all for showing up and being and participating in this panel. I encourage all of you to tune in tomorrow, Tuesday, April 26th at 4 p.m. Eastern for the How Mental Health Information Can Be Used in Resentencing and in Challenging Conditions of Confinement. It's a panel that is happening tomorrow, April 26th at 4 p.m. Eastern. Thank you all again for tuning in to our panel, and we hope that you have a fantastic rest of the day.